lecture, and I hope you must have learned a lot of things from it. So I congratulate all the students who explained it, who worked for this workshop, and they have done superbly today. Thank you. A few things which we consider to discuss a little bit more in detail. Something when you start a lecture on anything, it's like told to us by our seniors, and also we are studying how to teach students over here. So lecturing the students or presenting a presentation, it requires some skills. First of all, you must all be bored by now. Is it so? Because there was no interaction. Interaction is very important. The speakers must interact with the people, with the students sitting over here. Like if you start a lecture and you don't talk to the people listening to you, it becomes very difficult for them to gain something from there. You would learn a thing for 5 minutes, you would be awake. Let's say you are a very brilliant student who will be awake for the next 10 minutes. But after that, I want to sleep. Everybody of you just wanted to sleep. So discussing things and giving your lectures and discussing it, you must be in contact with your audience. By starting your audience, you should start your audience by questioning them, not by anything knowledgeable, anything general. So they will feel that they are into the thing now. They are not just dummies listening it. Otherwise, it was the best thing, but this is just my advice. We tell everybody, in your lectures, the lecturers are over here, in your lectures, you can do the same things. You just interact with your students. Try to engage your audience. Then what will happen? They will be in your, whatever you say, they will listen to it. Just like the same. Maulana, Bijligar Maulana. Why everybody listen to him and not any other mullah? Because he was continuously interacting with them by jokes, not allowing, by asking them, oh, to khude. Not every mullah in the masjid, they don't do these sort of things. What they do, they just start lecturing you without knowing that either you are listening or you are not listening. So there must be a spice in every presentation. There must be something to indulge your students in it. Okay? So now there is a little bit of things. Everything was explained beautifully. I was amazed by the speakers. They have done the research well. They have presented these things well, elaborated. The accent was fine, but the things there are just a little bit things left for me. So I just want to add something. वो जो क्या कहते हैं कटा की उंगली शहीदों में नाम करते हैं. So I will just explain a couple of things for you. So there are the recommendation of unanticipated and emergency difficulty airway management. Okay, there is like the unanticipated. There are two types of emergencies you will like the patient you will get. Two types. One type is an emergency patient. The other one is an elective patient. The difference between elective and emergency, there is a lot of difference between elective and emergency. In elective, you tell a patient to come nil by mouth. You tell them you have an operation You tell them you come a night before, come to our ward, we will assess you for any difficult intubation or any other things. We will do labs on you. We will do every sort of tests on you. What at the end will you do? You just come in the morning, nail by mouth, okay, what's in this? You have checklist of everything, you just checked it. Okay, this is a difficult intubation, ready for difficult. This is a simple intubation, go with it. But the actual condition is the emergency difficult airway. And where will you get the emergency airway? Emergency difficult airway. How can you get an emergency difficult airway? Do you know anything? Accidents. The most important thing is accidents. You have a traffic accident in RTA. What happened is, बंदा निकला था सुबह सवेरे, उसने खाना खाया था, नाश्ता किया, उसने सड़क क्रॉस कर रहा है, स्टूडेंट ने कोई उसको चिंची ने आके मार दिया। अभी क्या है? The patient is not NBM. We don't know the patient is having any cardiac issue. We don't know the patient is having any respiratory issue. We don't know anything about that. So what will happen? This is a unanticipated emergency intubation for you. You have not, Baba hai, he's working in his field. Subah savere nikla hai, and he's working and a bullet comes in, injures him. He has been brought to the emergency. We don't know any condition of him. Maybe he was a cardiac patient. Maybe he is hypertensive. Maybe he is asthmatic. There is nothing. There is a lady, a female lady, and she is being delivered by a dye in a periphery. And the case goes wrong, and she has been rushed to the emergency for emergency cesarean. It's another emergency, another difficult intubation, another nightmare. So what will you do? First of all, you have to call for help. Call for help. And call for help is not like this. What will you do? You can come out of your OR, your operating room, and you can scream. Chalo Charash hai Pukhto ke waaye, Urdu ke waaye, anything. But you have to call for help. Because a single person cannot manage the airway of a difficult airway. Then you have optimized oxygenation. The other things, these will happen step by step. But the important thing is you must, first of all, you must call for help. Then you must oxygenate the patient. If the patient is unable to be oxygenated, then what will you do? The students, they have explained you everything. What would you do after difficult? After the patient is not being oxygenated, then you have planned. There are two types of things you will go on. First of all, you will have an emergency intubation. The patient is not oxygenating, go for intubation. But you don't know the airway of the patient. So if you go for intubation and the intubation is failed, then what will you do? The next step, you will go for a surgical intervention. A surgical intervention. And the surgical intervention is that the front of the neck excess, and that would be the creep of thyroidotomy. So these are the basic steps. How will you go for that? Now, you will see when and where the patient gets your attention for a difficult intubation. Okay. So what will you do? It would be a stepwise thing. First of all, the patient comes to you, you oxygenate the patient. If the patient is unable to oxygenate, what will you do? You will go for a direct intubation. Direct intubation within the same time. And and an experienced anesthetist will do that. If he tries 3 times and he fails with the intubation, then what will you do? You will go for the supraglottic airway devices. You don't need to intubate a patient to go into the trachea. You can provide the oxygen to that patient with the supraglottic airway devices, which are available over here. So then you try for the supraglottic airway device. If the supraglottic airway device fails as well, then what will you do? Then you will go for the tricothyroidotomy, which is the last step in our emphasis. Okay? So going plane wise, like first oxygenation, then intubation, then supraglottic intubation, then at last the tricothyroidotomy. Okay, there are, well, you have secured the airway now. Tube vacho, Malik. Tissue is done now. But what if you have intubated the patient, you are giving oxygen, and the saturation is not getting up? What's happening over there?
Some sort of obstruction.
Well, you have like sort of the obstruction of it if you have put a tube in it. But if the thing is not, yes, there must be an obstruction lower down into the lungs. You have an X-ray of it, it shows no obstruction. You auscultate the patient, the oxygen is flowing in and out, but the patient is not saturating. The oxygen is not getting up. So what's happening over there? The basic function of the oxygen is it comes from the air, goes into our lungs, gets into our blood, goes to our brain, and goes to other part of our body, and goes to the pulse oximeter. Pulse oximeter पे आपको पता चलता है ना? What's the oxygen saturation over here? So यहाँ से तो सब कुछ आपने कर दिया. अब oxygen saturation ऊपर नहीं जा रहा. क्या करेंगे? इसमें क्या है? Lungs के level पे कोई मसला है? The lungs is full of water. The patient was drowned. और कोर के राप्रेवा तो दा ताज़ा पेशेंट ने में डॉक्टर ने भी दिया था अक्सर वो अवार्ड है वो उसको that all water juice पे उसका that all water juice goes into the lungs. Now the patient, you are providing oxygen, but the patient is not improving because you have blocked the oxygen combining with the blood. The alveoli, you have blocked the alveoli. So the oxygen saturation will not get up. What will you do now? You have to first take out the fluid from the lungs by suctioning. Okay? Now, okay, the lungs are fine, there is no fluid inside the lungs. Then what's happening? Why is the saturation not getting up?
We do cardiac arrest.
Maybe hypotension. First of all, hypotension. Cardiac arrest is plain, gone. So if the patient is with you and you have all the pulse oximeters and everything to the patient and the ECG leaves, at least the patient is not dead. If he is dead, then start CPR. But if the patient is alive and is not getting the saturation up, the other part of the thing, the blood, is he having enough blood? Is he having enough hemoglobin to carry away? No. If he is not, oxygen saturation will not get up. Now the heart. The other thing is the heart. If the patient is in a hypotension situation, the heart is not performing well. So the heart is not pushing the blood to reach to the organs and to reach to the peripheries. So the oxygen saturation will not get up. So these are some physiological things that can also occur in this. Okay, then if you have a difficult intubated patient and you have survived all these things for difficult intubation and the patient is alive and awake, then what will you do post-operatively? Then there is a follow-up, then there is a check. You cannot send this patient directly to the ward. or directly to home, because he can. आपने जो जितनी इस पे जो किया ना, कभी वो जो कह रहा था, कभी आपने वो सुप्राग्लॉटिक डिवाइस उठा के डाल है, कभी आप वो डाल रहे हैं, हाँ, एयरवे डाल रहे हैं, कभी आप नेजल एयरवे डाल रहे हैं, you are creating another trauma to the patient, and which will take some time to develop. The laryngeal edema takes a little bit of time. Maybe उस वक्त नहीं आपको दिख रहा है, लेकिन जब एक्सट्यूबेशन में वो laryngeal edema fully developed है, and we will take out the tube, the patient desaturates as well. So for that purpose, you have to put the patient in a post-operative clinic, post-operative ICU, or a high dependency unit, and closely examine the patient. So I think that was enough for this thing. I again congratulate the administration of this college, Dr. Nasir said, the management and the arrangements, and Dr. Mr. Tayyib for arranging such a beautiful workshop, all the anesthesia department over here, and also the students who have listened very disciplinarily to this workshop, and I hope you have learned a lot from this. Now we will move to the practical presentation, and there you can have some groups of
Just one presentation.
Huh?
Your presentation.
Your presentation.
Yeah, one.
Okay. Then we will move to the presentation. For that, there must be a dummy or something, or a live thing. Like a Jaldi Maris thing about it. How do you